As I was handing out one of the crochet blankets my mother made to donate to those who are cold in the elements, I heard a loud voice coming from another side. I turned to see a man in a brand new truck who had rolled down his window during rush hour traffic to tell me that we should, quote, shoot the homeless, shoot the man I was providing a blanket to, rather than give them supplies, end quote. Now, the man I was giving a blanket to is one of the sweetest people I have met, and he is someone who refused housing offers because he would not have been able to bring his dog with him. He chose to remain living outside in the elements, feeling this hatred from other members of society and more, than to leave his dog behind. Kindness and empathy seem in short supply these days. I can't help but notice the lack of empathy for others and hatred that our country has seen over the past few years. History has shown us that losing empathy for others, specifically those who we think are different than us, can lead us down a slippery slope. One of the ways I'm trying to combat this and stand up for the people I care about is by creating the Seeking Human Kindness podcast. My goal is to honestly answer questions and talk about various topics with the intent to destigmatize homelessness and encourage collaboration to end homelessness together by seeking human kindness. Hello, everyone. My name is Whitney Cole, and today I'm hosting the Seeking Human Kindness podcast, where I will be answering questions my classmates and professors had asked me anonymously about homelessness. The first question I will be answering is regarding drug use and homelessness, as well as the person was wondering if I would suggest handing out money versus supplies. I would first like to start off answering this question by stating that drug use is bidirectional, meaning that it is not always the assumed stereotype that someone becomes unhoused due to a drug addiction, but commonly people begin using after something else caused them to be homeless. There's a statistic here that states 38% of homeless people abuse alcohol while 26% abuse drugs. Furthermore, most research shows that around a third of people who are homeless have problems with alcohol and/or drugs, and around 2/3 of these people have lifetime histories of drug or alcohol use disorders. Another statistic I found was that 257,000 people who are homeless had a severe mental illness or a chronic substance abuse issue. Now, to address the second part of the question of whether or not I think someone should give food or money to someone who is homeless, I would first say to, of course, do whatever you feel most comfortable with. It's your decision, and they truly will appreciate any help that you have. Something I've realized is that even if you don't have anything to give, you can always say hello or give a smile. It sounds cheesy, but a lot of the times people experiencing homelessness are dehumanized because they're ignored. People turn away at the sight of them, and I just think that's so devastating. So even just saying hi and talking to them, having a conversation, asking how they are, can really make a huge difference in their lives. Oftentimes, what my patients or people out on the streets needed most was someone to listen. And specifically to answer the money part of the question, my opinion is that it's not really fair to withhold it because of some people's decisions. I personally feel like if you just handed me $5, I probably would end up spending it at Shovel Bar because I'm grateful for $5, but that's not going to add up to buy me a house. So I feel like I just feel like it's not fair to hold that high level of stigma when I think a lot of us would be using that money for drugs as well. The second question I received is regarding people faking being homeless and if I knew the statistic on that. This is another common statement that I hear, and I haven't really found any statistics that are valid and back up the claim of the number of people who are faking being homeless versus who actually is. I know one of my dearest patients once went to fundraise money so he could pay for transportation to a job, and he ended up not getting any money because he thought that he didn't look homeless enough, and he was wearing nicer clothes and his arm was bandaged and put in a sling, but that was from a wound that we were treating. And I would just say, toward everything else, you cannot judge a book by its cover. He had nicer clothes because of donations that he had received, and the treatment he was receiving for his arm was at our clinic where we treat people for free regardless of insurance. I also think it is an assumption that someone holding a sign on the road and you see them, it's an assumption that they are homeless. A lot of times people have signs and it does not actually say on there that they are homeless. So people are assuming that they are, but they're not telling you that. It's not a lie unless they write it on there and then they aren't. And I also feel like if someone is sitting out there in front of others and probably feeling very vulnerable and feeling humiliated to ask for help and seeing how people are judging you and assuming things about you. I feel like someone would not be pretending to do that if they weren't far from being in that situation. I really doubt someone who has the finances would just choose to do that because it would not be fun, and I can't imagine it, and I feel sorry for anyone who is at that level. And again, I feel like this question goes in hand with the previous one, where I would say, again, it's not really fair that if someone is faking it and that's a bad decision to lie, that it would prevent others who really do need help from receiving it. I think more often than not, people are homeless like they are saying, and they would need help. I combined two questions here. So the first question was, are more males or females homeless? And then another person asked, why are men more likely to experience homelessness than women? So yes, men are more likely to experience homelessness. 60.6% of the estimated homeless population in the United States in 2022 were men. Furthermore, men are also more likely to be unsheltered, meaning living outside in the elements. 49% of unsheltered people were male, while 45% were female. Men are more likely to be homeless than women for various reasons. These include unemployment, limited social support networks, and issues regarding mental health and substance abuse. The next question is about the leading cause of homelessness in Pittsburgh. The leading cause of homelessness in Pittsburgh is suffering from mental health conditions, lack of affordable housing, and addiction. In Pittsburgh, there are only 37 low-income houses available for every 100 low-income renters. A quote from the Light of Life mission, who I've worked alongside, states, "People lose jobs leading to homelessness. Women flee domestic violence. Many battle mental illness, depression, or post-traumatic stress and need extra support. Those facing eviction or release from prison must become homeless before accessing county resources, often waiting a year or more for housing support." Question 5 asks us the general factors leading to homelessness and what is currently being done to lower it. Factors leading to homelessness outlined by the National Alliance to End Homelessness are lack of affordable housing, lack of housing in general, health issues, escaping domestic violence, and racial inequality. In the United States, it is really street medicine movements and other movements all around the country that are aiming to support the homeless and want to see a future where people are housed. The next question is about areas like location that have more homeless population. About 653,000 Americans experienced homelessness in January of 2023, according to the Department of Housing and Urban Development point-in-time data, which measures homelessness across the United States on a single night each winter. That's a 12.1% increase from the same report done in 2022. New York and Vermont are the two states with the highest rates of homelessness, and the Washington, D.C. area has the highest overall. Just looking at numbers, not comparing them to the population size of each state, California had the highest number of people experiencing homelessness of any state, with 181,399 people. New York had the nation's second most, with 103,200 people, followed by Florida with 30,756 people. This data shows how homelessness is not a rural or urban issue. For example, Vermont is the nation's most rural state. As of 2020, 65% of its population lived in rural areas, and yet it had one of the highest rates of homelessness. California and Nevada are the states with the highest percentage of inhabitants in urban areas, and their homelessness rates were also in the top 10. One explanation for some states having higher rates of homelessness than others is rent prices. According to a 2022 Government Accountability Office report, California, Washington, D.C., and Hawaii had the nation's highest rents in 2022 and among the highest rates of homelessness in 2023. All three were in the top 10 nationally. West Virginia and Mississippi had among the country's lowest rents and lowest homelessness rates. Question 7 asks if there's a way to break the negative connotations surrounding homelessness. To answer this question, I think a way that we can do this is to educate ourselves, use empathy and critical thinking skills, gain personal insight before speaking on a topic or judging of others, and have meaningful conversations with others. One way I am trying to destigmatize homelessness is through projects like this that allow me to address stigmas people may have because they have been fortunate enough to never experience homelessness themselves, or if they have not had an experience where they have worked with this population to know any of people's stories or to know more information about it. Question 8 asks if there are any government-assisted programs that help the homeless, and if so, what are they? Here is a list of programs that I found that are all government-assisted. Question 9 is, how does the state of PA help combat homelessness? There is a Pennsylvania Continuums of Care that has numerous programs. One is the Department of Community and Economic Development, which has numerous programs available to address homelessness and those seeking resources for housing, rehab, and first-time homebuyer assistance. Another one is called the HUD Exchange, which provides numerous resources and lists of local agencies that can provide a range of services, including food, housing, health, and safety. The Department of Human Services Homeless Assistance Program helps to assure that homelessness can be avoided, people who are homeless can find refuge and care, and homeless and near homeless clients are assisted in moving towards self-sufficiency. Furthermore, you can simply dial 211, and that is a free 24/7 service that provides information and resources related to health, housing, and human services. Question 10 is, what are the death rates among the homeless population in PA and the U.S. in general? Data shows that the death rates among PA and the U.S. in general are actually around the same, with a steady increase throughout the recent years. So the rate is 3,183 per 100,000 people, and that was measured in 2021. How much aid does PA give the homeless, and how much does the federal government give in aid to homelessness? Our Governor, Josh Shapiro, recently invested more than $6.3 million in communities to help combat homelessness. Specifically, $490,000 went to the Center for Community Action to deliver homelessness prevention and rapid rehousing services in Bedford, Blair, Cambria, Fulton, Huntington, Juniata, and Mifflin counties, as well as the Cambria County Women's Help Center, which will deliver street outreach and emergency shelter services. In regards to federal aid, the Biden-Harris administration awarded $3.16 billion in homelessness assistance funding to communities nationwide. This money went to over 7,000 projects, which represented the largest amount of annual federal funding provided through the HUD's Continuum of Care program in history. This expanded housing and services projects for people experiencing homelessness, which includes survivors of domestic violence, dating violence, stalking, and sexual assault. The next question is, what are the economic consequences of homelessness, and in what ways may the general public be affected? The economic consequences of homelessness impact everyone, which is one of the many reasons we should all care about ending homelessness together. Specifically, it impacts the availability of healthcare resources, crime and safety, the workforce, and the use of tax dollars. A 2017 study completed by the RAND Corporation found that the cost for public services consumed in the year after receipt of long-term housing declined by nearly 60%. Furthermore, they found that in the year prior to housing, participants received public services that cost an average of $38,146. Now, that total fell to $15,358 in the year after housing was received. Even after taking into account the cost of permanent supportive housing, savings to the county was about 20%. This data portrays how it is actually more cost-effective to house people than it is to do nothing. That is because doing nothing about homelessness costs $38,000. The Supreme Court justices who recently and disgustingly ruled that it is acceptable to arrest people who are unhoused for simply sleeping in public places falls under the umbrella of a strategy plan of just thinking jailing homeless people is the best option, despite it being unethical. It would actually cost over $24,000 to follow that plan, so it's not even cost-effective. It would take up spaces in jail from people who actually committed crimes, and it is unethical and would further force people to be stuck in a cycle because a criminal record lowers the options for jobs that they could work. CaringWorks is an agency working to end homelessness in the greater Atlanta area, one person or one family at a time. They provide comprehensive services and resources to the people residing there, including access to housing, mental health care, addiction treatment and education, and employment assistance. For people who vote or form political beliefs with empathy, morals, religion, it should be apparent based on those principles that it is unethical to allow homelessness to continue. It is inhumane to watch people suffer and continue to act like they deserve what is happening to them when no one does. Now, for people who are more inclined to vote with economic policies in mind, this figure conveys how it is actually more cost-effective to provide housing to people experiencing homelessness compared to what we've been doing, which is nothing, or disproportionately criminalizing people in hopes for them to just be permanently housed in jail when being unhoused is not a crime. So regardless of how you vote and how you form your political views, data shows housing people is the solution. What laws do we have in our county regarding homelessness? Laws regarding homelessness in Cambria County are decided by local law enforcement. More recently, we have seen a lot of decisions made by our governor, Josh Shapiro. He signed Executive Order 2024-03, indicating his administration to create Pennsylvania's first comprehensive housing action plan to address the state's housing shortage, address homelessness, and expand affordable housing options, ensuring Pennsylvanians have access to safe, affordable housing and attracting more people to live here in the Commonwealth. Our last question on this episode of the podcast asks, what can the average person do to participate in the help of decreasing the rate of homelessness that is actually effective, and what is the most helpful way to get involved? One of the biggest ways to get involved is by advocating for people experiencing homelessness. I know there unfortunately is an existing stigma surrounding people experiencing homelessness, and I believe that the more we talk about it with factual data, we can combat this stigma that is mostly based on misinformation. In terms of effectiveness, we need a policy change to change the number of people experiencing homelessness. This means voting for candidates with plans to lower the cost of homes and make low-cost housing options available. Candidates who want to increase the minimum wage, as many people who are homeless actually do have jobs. Candidates with plans for an affordable healthcare system so people can receive treatments without it breaking their bank, even if they have insurance. Candidates that want to give tax breaks to the lower class, not billionaires. And lastly, candidates with empathy who can connect with people. Another simple and impactful way to get involved is to volunteer at soup kitchens, street medicine teams, and shelters. Donating supplies is helpful as well. And like I mentioned earlier, you can always simply smile and acknowledge someone's presence when you see them. One of the major and devastating aspects of homelessness is the literal dehumanization of them that occurs. People turn away at the sight of them, not even treating them like human beings. Even just saying hi and acknowledging them as a human being can make a huge difference. Here are all the references used to put together this podcast. This includes any images and all of the information that was cited in order. I want to thank you all for listening to the first episode of the Seeking Human Kindness podcast.